Hi, I'm Dr. Jim McDonald, Medical Director at Rhode Department of Health, and I'm here with Dr. Phil Chan.
Hello.
And thank you so much for joining us today. You're volunteering, you're helping us to manage COVID in Rhode Island, and we really appreciate that. One of the things we're going to talk about today, though, is why we wear masks and why masks are such a big deal, why they're so important. But Dr. Chan, aerosols, viral particles, getting in the air, what is this all about?
Yeah, thank you, Dr. McDonald, and I also want to thank everyone for your help, and especially during this pandemic time. So masks, so I think a lot has changed, and we're still learning a whole lot about COVID-19 as this pandemic progresses. I think what we've realized is that for the most part, this virus is transmitted by what we call as droplets. And that's why we have the 6 feet rule, actually, is because we know that the droplets, when someone coughs or sneezes, they tend to fall to the ground before 6 feet. And so you want to be past 6 feet for when you're around someone that's potentially infected. But that's where masks come into play too, right? So when people wear a mask, when I'm wearing a mask, if I have SARS-CoV-2, the virus that causes COVID-19, it will protect others around me. If I sneeze or cough, this mask will actually catch those droplets and protect others from being infected. The other thing that we've sort of learned, and I'm sure that a lot of people are aware of this, is that this virus can also be transmitted occasionally through airborne particles. And those are different than droplets. So for droplets, they're these larger particles, they fall to the ground. With airborne transmission, what happens is the virus kind of floats in the air, and it can travel further than 6 feet. And we think that's unusual, it's rare. We're still learning about this, but that's another reason why masks are so important.
So why I wear a mask? Right now I'm doing this video with Dr. Chan, but I'm actually wearing a mask to protect Dr. Chan. He's wearing a mask to protect me. That's called source control. In other words, I feel fine. I am not sick today. I feel great. However, I could be pre-symptomatic or asymptomatic. I could have the virus in my body and just quite frankly, not know it. That's true for any of us. So why we wear a mask is so we protect the others around us. And that's something where all of us need to do this for this to work. It's part of the social contract. I depend on you, you depend on me. If we all wear a mask, then we all protect each other. SARS-CoV-2 is a preventable disease. If we could get 100% compliance with mask wearing, guess what? The disease would go away in 4 weeks. I know that sounds outlandish, but it's true. In other words, if we get all of us to wear a mask and make sure our mask wearing is appropriate and correct, then we really could eliminate this disease.
Dr. McDonald, if I may too, the other reason why we wear a mask is to protect ourselves to some degree. So if I were not wearing a mask and I coughed, the particles may be somewhat filtered through your own mask. It's not as good as you mentioned as source control, but the other thing that we're learning too, and the importance of masks, is that even if you were to become infected, the amount of virus that you're exposed to determines how sick you are. So the fact you're wearing a mask does protect the world from you, but it also protects you. And if you were to get sick, the mask will help reduce the number of viruses, and you may not get quite as sick as if you didn't have a mask. So another important point of why we should all be wearing masks.
Speaking of masks, why don't we talk about some of the masks that people wear? Like right now, I'm wearing a medical procedure mask. You are too. A very common mask. I think they're comfortable. Do you like yours?
I do like it. And I think one thing to keep in mind, if you look at how these are made, and specifically the medical mask, there's actually 3 layers in here. And they're meant to be breathable, and they're meant to be comfortable. And so if you find that you're a little bit uncomfortable wearing one type of mask, and Dr. McDonald is about to go over some of the other types of masks, I do encourage you to try different types of masks. And if you really are finding some of these other things a little hot or heavy, try some of these lighter weight surgical procedure masks, and I found them very comfortable.
And that's what they're designed to be worn all day long. So let's talk about some of the different masks that are out there. This one is called an N95 mask. So an N95, the N, by the way, stands for not resistant to oil. This is something I wear when I'm in the hospital seeing a patient who is coughing or sick. In other words, this mask does provide source control, but the main reason this mask is used is to protect me as a physician from a patient who might be contagious. So an N95 like this is a pretty good mask and it's great. But this is a medical grade N95 mask, and I want to distinguish that from a construction grade N95 mask. Now, I like this mask. This one, not so much. This is an N95 for construction purposes, and you'll notice it has an exhalation valve on it right here. So the original design for this was for someone who was doing some sanding, some carpentry, some painting, and they needed to have some protection for themselves. But the exhalation valve is so the air escapes that. Notice there isn't an exhalation valve on the medical grade N95 mask here. the problem with this mask, if you're out in public wearing this mask, is it's giving you protection, but it's actually focusing your exhaled particles on the people around you. So I wouldn't recommend you wear this mask out in public. Not a good idea. Dr. Chan, any other thoughts about the N95 with an exhalation valve?
Yeah, totally agree with you. I will say for the medical N95 masks, I know they look kind of simple, it looks like sort of a cloth mask, but these things are actually marvels of engineering in my opinion. I mean, there are thousands of interwoven microfibers there, and what happens is essentially the virus is filtered out as it goes into this. So these masks are actually, I mean, they're incredibly constructed, and there's a shortage of them, which is why in general we're reserving them for the medical workforce.
A fine mask and been around a long time. We're glad to have them. And this one is sized to fit me. I've been fit tested for this one. This is called the 3M regular size mask. This is the same type of mask, but for someone who has a smaller face, this would be the mask they would do. So it's fit tested. However, you don't really need to have an N95. If you're out in public, a medical procedure mask is fine. However, a cloth mask might be what you prefer. These are very comfortable. And as Dr. Chan, as you talked about, finding the right mask for me, it's a little bit like finding socks. I'm pretty particular about my socks. So I had to figure out which one's like. Now, I happen to like this cloth mask. It's the Mets mask. Now, if you're wondering why I have two, I wear this one when the Mets are playing at home, this one when the Mets are playing away when I'm home, because I have a little variety in my life. But these are just fine. They're made of multiple layers. You can see here, there's white on this side, a little layer in between, but they're cloth, very comfortable. Important though for the mask to cover the nose and the mouth. Dr. Chan, why do we have to cover that nose? What are your thoughts on that?
Yeah, you want to be careful about wearing masks, right? So the entire point of wearing a mask is to protect the nose and the mouth when you breathe in. And so if you don't mind for a second, we do see a lot of people wearing their masks like this, sometimes around their neck, but this is not going to work. You might as well really not be wearing a mask at all, right, if you're going to wear it like this. So really encouraging people to wear it correctly. Make sure it's pinched above the nose, it's covering your nose and your mouth. And this is proper mask wear.
One of the things I think about too is if you really want to spread a lot of virus at one point, just sneeze. But if you sneeze wearing a mask, you've contained your sneeze. If you sneeze and your mask is down there, you're just propagating virus. So other masks that we're not too thrilled about, I do like Star Trek, but this is the Gator style mask. This is my Commander Data Star Trek mask. This is my Captain Picard Gator mask. So I bought these early in the pandemic before the research came out and showed we had some challenges with these. Now, these are one layer. They're very thin. It's kind of interesting. My son Christopher was wearing one of these, hadn't shaved that day, and you could see whiskers. And if a whisker can fit through the mask, the particles are gonna drive right through here. So really, it turns out these single layer Gator masks aren't that effective at source control. Dr. Chan, what are your thoughts on these Gator style masks?
Yeah, there's been some evidence about this that's been published, and what happens is with these lighter sort of Gator style masks is when someone coughs or breathes or sneezes, what happens is the particles actually go through, and we think actually they may be worse than not wearing a mask, because what happens is the droplets actually splay out even more, so you get more dispersion, and it's actually creating more of an airborne dispersion, and this has been shown in science. So it's almost better not to wear a Gator mask than no mask at all. So we definitely encourage one of the other types.
What about the bandana? I didn't bring a bandana with me today, but what about that bandana style mask? Do you have any thoughts on that?
I think they're not quite as good as the other masks. So really, if you're gonna wear a mask, the surgical procedure mask like we're wearing, or the cloth masks, and in certain situations, healthcare workers, the N95s.
I mean, the medical procedure mask, I like this one because it's used for what it's designed for. I procured these through a major online retailer. They're actually much more affordable. And I don't know about you, but I keep mine around for a day or so, then I throw it away. And they do last, but I think you can keep them as long as you want, but after a day or two for me, I just get a new one. They're not that expensive.
Yeah, so I think for cloth masks, just going into how to take care of masks, cloth masks should be washed. They should be washed in the washer, dryer, hung up to dry, and that's good care for them. For these masks that are disposable, you do want to dispose of them if they become visibly soiled or wet, etc. I wear mine, a few days, maybe a week. I do hang it up in the car. I think that's typical for a lot of people. So you can re-wear them. But obviously if someone coughs right on you, or you feel like you're exposed, or obviously if they're wet or dirty, you got food like hanging off, you probably want to throw them away.
Now when you're putting on your mask, it's really important that your hands be clean. So I have my hand sanitizer here, just as a reminder. But if I'm gonna put my mask on, I take my hand sanitizer, clean my hands, then put it on. And then I try not to touch the blue part of the mask. I'm just trying to touch the ear loops, because this is the part that is the most commonsensical. When you're taking a mask off, easy way to take it off is just take it by the ear loops, take it off, and then, fold it up and put it somewhere, and then you have it for the next time you need it. I think when you're putting it back on, same thing. Ear loop 1, ear loop 2, and then I will do a little scrunch at the top on both sides equally, so I get a nice little scrunch up here. If I do it correctly, I'm not gonna get air flowing up and getting my glasses all fogged up here. When your glasses are getting fogged up, what it means is you don't have your mask on correctly, because what your glasses are getting fogged up with are respiratory droplets. And one of the things about respiratory droplets is anyone who's ever woken up on a cold New England winter morning, you've gone outside, you've exhaled, you see your breath, and those respiratory drops are freezing so you can see them. What we're trying to do is avoid that. So, Dr. Chan, what are some thoughts about giving masks to others? Should we be sharing our masks? What do you think?
So, no, we shouldn't be sharing masks. If you clean them and launder them and make sure they're clean, then yes. For these disposable masks, obviously we shouldn't be reusing them. For cloth masks that has been used, you shouldn't be reusing them. And also for N95s, also should not be sharing.
It's interesting, I remember Rosa, who works down 205 with me, had some masks made at home when she brought them into me, which is very kind. So giving masks that are brand new to other people or masks that are thoroughly cleaned are totally fine. Like, we wouldn't trade masks in school like you might trade lunches. And that's probably not a great idea either right now. But just important to remember that we really don't want to be sharing objects right now. And if you're touching an object, use hand sanitizer first, and then after you've touched it as well. And then what about how to store a mask? Is there any little tips about storing a mask you want to share?
So for N95s that I have as a medical care provider, I do keep them in brown paper bags. I think they're a little bit breathable. Brown paper bags, most people have them, so they can be stored. For these masks, I do what a lot of people do. I actually hang them up on my car, right? When I go in somewhere, I'll stick them on my mirror, let them hang down. Something to be said for airing them out, like sunlight we know is also very, it kills the virus, but that's how I store them.
And then as far as cleaning masks go, these are disposable. I wouldn't launder them, I wouldn't clean them, I'd replace them. If you ever get a little damage on one of them, I just throw it away as well. And then otherwise, a mask like this, your cloth mask, I just throw these in the laundry, like I do the rest of my laundry here. It needs to be clean, not sterile. So that's what we're looking for. And then a couple other thoughts here. Decorating masks. What are your thoughts on mask decoration? Any thoughts about that?
Yeah, so I got 2 kids, 9 and a 13-year-old. I think decorating masks is kind of cool. You want to be careful not to create any cuts or breaks in the mask. You don't want to do anything that would violate the integrity of the mask. But I think doing a little doodling or other arts and crafts on the mask, go nuts.
Well, I think we're coming to the end of our time today, and I think we'll just summarize with this. I wear a mask to protect others, and that's the main reason. There's hospital-grade masks, and if you have access to this, it will protect you, but these are primarily used for in the hospital. Any final thoughts, Dr. Chan?
No, just thanking everyone again. Thank you for your work in the community. Thank you for keeping us safe and for doing your part.
Thank you again. It's words from you, trusted neighbors, that make the most difference. So thank you so much for doing your part to share with your neighbors why we're all wearing masks.